So the different types of lung cancer surgery can vary between a wedge resection, which is removal of small piece of lung, to a pneumonectomy, which is removing the whole lung. But typically, when we talk about lung cancer surgery, we're talking about a lobectomy. Now, the lung is divided into sections or lobes. On the right side, it's divided into 3 sections or lobes, and on the left side, it's divided into 2 sections or lobes. Typically, for a lung cancer, we recommend a lobectomy, or the most commonly performed surgery is a lobectomy, which involves removing the lobe or the section of the lung that the cancer is in, together with the blood supply, the airway, the lymph nodes, and everything that goes to that section of the lung. And this is what we call a lobectomy. Now, of course, depending on the type of the cancer, the size of the cancer, and patient factors, general health and medical fitness of the patient, we might decide to do what's called a wedge resection, which is removal of a smaller piece of lung, which is like a wedge-shaped or a pie-shaped portion of the lung that contains the tumor in it, with a clear rim of tissue, with a clear rim of healthy tissue around it. And this can be used, again, for very early stage tumors or when we think that the patient is not going to be able to tolerate losing more lung tissue. The other procedure that we could do is called a segmentectomy. It involves removing a slightly larger portion of the lung. So it is still a section within this bigger section of the lung, still with the blood supply, the airway, but to a smaller section than a lobe. Again, this could be used when we think that the patient cannot tolerate a lobectomy or certain features of the cancer that make it acceptable to remove a smaller section of the lobe. A lobectomy, as we discussed, is removing the lobe, the full section of the lung. And every so often we do recommend a pneumonectomy or have to do a pneumonectomy, which is removing the entire lung on one side. Now, this might be an indication when the tumor is very central or it's spanning across multiple lobes where we cannot cure or remove the cancer with just removing one lobe. Now, these are all surgeries that can be done in a minimally invasive way or with an open technique. So the minimally invasive way is called a thoracoscopy, where we use small incisions and use a camera and stick-like instruments to perform the surgery. Typically, I do this with robot assistance. So robot-assisted minimally invasive surgery is the way I do most of my surgeries. This offers higher definition visualization, a 3D visualization, and helps with more precise movements. And this is one of the ways of doing minimally invasive surgery. Another way is doing it with the camera and stick-like instruments without the robot. The other way is the open technique, where we would make an incision between the rib spaces, and this is sort of the more traditional way. Having said that, it could still be used if the tumor is larger or if there are certain patient factors that do not permit using a minimally invasive technique, then we would use the open technique, and this is called a thoracotomy.